Hello, Yavapai County. I'm Leslie Horton, Director of Yavapai County Community Health Services. Today I'm here to report that there's 2,190 cases of COVID-19 in Yavapai County. We only had 6 new cases overnight, which is really good news because we're seeing a continuation of the downward trajectory in new cases each day. We are reporting 76 deaths in our county and 875 individuals that have been deemed recovered. Back when we saw the peak of cases in early July, we did have a number of cases added into our count in Yavapai County really quickly. So right now we are making those calls to find out if those individuals are deemed recovered at this point in time. We will see more of those numbers in the coming days and weeks. So far in Yavapai County, we've had 34,084 people tested. We are seeing an average of about a 5.5% positivity rate, and that's how many people have tested positive out of all of those tested. That positivity rate is one thing that we're looking for in the metrics to both reopen bars, gyms, and other establishments, as well as our schools being reopened. The Arizona Department of Health Services has put out metrics that guide those reopenings. Currently, Yavapai County falls into the moderate spread category for reopening of bars, gyms, and other businesses, as well as reopening of schools to a hybrid model of education. You can always refer to the Arizona Department of Health Services website to understand better those metrics and see where we stand in terms of those reopenings. Our school districts and business owners are all making decisions to carefully reopen in a way that we hope won't increase the spread of COVID in our communities. Today I'm joined by Joanne French. She's a part of our epidemiology team at Yavapai County Community Health Services. Thank you so much, Joanne, for joining me.
Pleased to be here.
Well, Joanne, you've been working on a number of projects within the health department and throughout the pandemic. Could you tell us what you've been helping with more recently?
Oh, I've been doing case investigations, so we call people with positive COVID results and want to get information about this bug that's taken over our world so that we can learn something about it. So if it wants to come back, or even if we have other infections in the future, we're going to understand more of how we can protect our community and our loved ones.
So now you've been calling individuals that have both tested positive for COVID-19 as well as those who may have been contacts of people that have been currently diagnosed with COVID-19. So what are some things you'd like the public to know if they receive a call from Yavapai County?
When we call, and we have lots of people calling, they will be leaving a message giving their name and that they work for Yavapai County Health Department. And if you could call us back, we would appreciate it. We're gathering information. We have to learn more about this infection. And so take our calls. We try to make it as easy for people as we can. We know that if you're sick, you're under a lot of stress, and we appreciate that. We try not to keep you too long, but there's certain information that we need so that we can get this thing under control.
So you bring up a good point, and you're learning things as you call people about commonalities or trends. And what are some pointers that you have for Yavapai County residents in terms of what to do to prevent COVID in their lives?
Well, the most important thing is social distancing. The face masks, the face coverings help in slowing down the germs going out from somebody. But it's social distancing that's going to make the difference. And so as bars reopen and gyms reopen, I know it's going to be hard to use masks in the gyms, but you want to be aware of when people are breathing over you, because the bug has to follow the laws of gravity just like the rest of us. Those kinds of things will make a difference. Use the face mask to remind you that you need to be 6 feet from somebody else. Being outside, great way to get sunlight, helps you fight disease. The virus doesn't like it, take advantage of it. We've got lots of it.
Yeah, and I always like to remind people, one of the reasons why we stand so far apart here is it's an adequate social distance. And when you're looking at a physical or social distancing, you want at least about 6 feet between you and someone else. And that will mitigate that spread and the it'll block the COVID from being able to travel from you to someone else. And like Joanne mentioned, those other things like the breeze, sunlight, and dry air definitely deter COVID from spreading from you to others if you happen to have it and are asymptomatic. One thing I've also noticed recently is that most of the contact tracing that I've helped with at larger settings like workplaces, hotshot teams, other agencies that I work with, a lot of the spread does happen while someone is sick. Are there always severe symptoms that people are experiencing, or sometimes is it very mild symptoms?
Oh, we have some people who are so proud that they were sick for one day with one symptom. And it's like, you probably should tune that down a little bit because your wife has been sick for 3 weeks. They're not going to be happy to hear that you were sick for only 48 hours. So it runs the gamut. People who work in the same place, probably exposed by the same person. A couple of them are able to do telecommunication with others. One of them's too sick to get out of bed. It really is your relationship with the virus that calls the shots.
And so I think that brings up a good point in that it's very important to really follow the protocols that your doctor or we and Arizona Department of Health Services and CDC have put out there to quarantine for 14 days from the point of a contact with someone who was knowingly infected with COVID-19, or 10 days from the point that you get tested. And so it's important that even if you were just sick for a moment or had a light fever or very light symptoms, or if it went away quickly, that you still maintain those protocols, because people can spread this, especially in pretty close proximity to others, even if they're not sick. And so keep that in mind. Make sure that if you do test positive, that you follow those protocols in place no matter what. But the number one rule that I've learned with COVID-19 is if someone is sick, they need to stay home. So during this pandemic, it's not the time to go ahead and get to work even though you're feeling sick, as we would have maybe in the past sometimes. And so right now, if you do have any sort of symptoms, make sure that you stay home. In the case of COVID-19, it's very infectious at the point where you have symptoms. And so it's important that people don't go out in public, don't go around people that they work with. It could quickly spread through all of your coworkers and your entire team. So is there anything else that you would like our public to know, especially as we get close to flu season here? Is there some pointers that you might have for people?
Well, get a flu shot. That will decrease the confusion as to whether the symptoms you're having are COVID or the flu. And so those will probably be starting fairly soon. And as yet, we don't have a vaccine available for COVID. They're working on them. But yeah, get the flu shot so that we have less confusion, less symptoms to be wondering if it's this or it's that.
Yeah, and those symptoms can be very similar.
Oh, yeah.
COVID seems to follow along very similar symptoms as the flu, with a fever, shortness of breath, coughing, runny nose, other things that, even gastrointestinal distress, that can mimic flu-like symptoms. And so, like Joanne said, we are going to be getting flu shots here shortly. Please get your flu shot this year and boost your immune system to be prepared for whether you come into contact with the flu virus or with COVID-19 this year. It will help if your immune system is in tip-top shape. Well, thank you so much, Joanne, for joining me here today. It's been very nice talking to you. You've had some very good pointers for our Yavapai County public that's watching, and I do hope that people will do their best to continue to bring down those COVID-19 numbers in Yavapai County. And so thank you, Joanne, and thank you, Yavapai County. One thing I have noticed is that there are a lot of people working very hard in Yavapai County to bring down the spread of COVID, to stay at home more often, to wear masks when they can't physically distance, and do all of those things we've been asking. And I have one more thing to ask of you, and that is to be kind. One thing that I've noticed a little more of recently in our communities is that people are stressed. There is more anxiety and more burden on our lives, probably more than we've experienced in a very long time. And, although it is a difficult time, Please go out of your way to be kind to others. Please realize that people are doing the best they can during this time. And if you acknowledge others, be kind to them, and go about your day. It may even improve your own day, but it'll definitely leave an impact on others around you. So thank you, Yavapai County. You're doing a great job. Keep up the good work, and I'll talk to you again soon.